The information provided on this podcast is not legal advice and is intended for the sole purpose of providing education and legal information. Laws change over time, and the information provided on this podcast may not be up to date. We make no warranty, express or implied, regarding the information provided by our team or our guests on this podcast. The information should not be construed as legal advice and does not create an attorney-client relationship with us or any of our guests on the podcast. If you would like to consult with an attorney, please call 1-800-VICTIMS. That's 1-800-842-8467 for attorney referral contact information. This podcast provides a platform for the exchange of ideas and information to help educate crime victims on their rights. Some content will include topics and materials that may involve descriptions of violence or assaults which can be distressing to victims and survivors. It may also impact service providers experiencing vicarious trauma. Podcasting from the Victims of Crime Resource Center, this is Season 2 of Knowledge is Power, Victim to Survivor, a podcast series where we help crime victims understand their rights so they can go from victims to survivors. On this episode, we'll discuss mental health services with Dr. Amir Ramezani. Welcome in, everyone. It's me once again, your humble host, Nima Malavi from the Victims of Crime Resource Center. And today it's my pleasure to welcome in Dr. Amir Ramezani into the podcast. Dr. Ramezani is a psychologist at the University of California, Davis, where he is also an associate clinical professor. Dr. Ramezani also holds a private practice at the Center for Cognition and Compassion. He also works as an expert witness on trauma and brain function. Dr. Ramezani, thank you so much for coming into the podcast today.
Thank you so much. Thank you for having me, Nima. Happy to be here.
Yes, thank you. I'd like to start our conversation by discussing how a person's mental health can be impacted by being the victim of a crime.
Yeah, that's a good question. I think it can impact the person in many ways. The way I often will think of the reactions of someone who has gone through some sort of traumatic event, like being a victim of crime, is that they're going to have normal reactions that anyone would have to some sort of abnormal situation. So I often will, as I say these reactions, I like folks to think about it as really having these normal reactions as a result of being in an unfortunate abnormal situation. So if we think about when folks are going through some sort of traumatic event, their reality in that situation is changed completely. Actually, something that's outside of their reality happens. And so it's very normal for that person to suddenly not be able to trust what's happening in their environment and even with people. So trust in themselves, sometimes even trusting their decision making, trusting the people around them. That could be a very hard situation for them, and it could be often an expected reaction. And another thing that happens that I think can be a lot of times barriers to getting treatment is normally the person, because the situation is so scary and some folks may not have resources, they'll normally feel shame, they'll feel guilt. Of course, there's anger with the situation, which often the anger helps them to really take action. Mm-hmm. Unfortunately, the shame and the guilt kind of prevents them from taking action. And when these reactions, because a lot of times our mind is trying to make sense out of what happened in this very unrealistic situation, our mind begins to replay the event in forms of either like flashbacks or dreams, or even our body begins to have reactions. So it's very normal, for some folks to have panic attacks because their body, in a sense, is saying, I need to be alert here. I need to be very hypervigilant about what's happening. But unfortunately, that hypervigilance leads to, anxiety, panic, anger outbursts. And it really leaves the person feeling a sense of isolation, I think, as well. And these are very normal reactions to have, but it's helpful to, put them into context, because a lot of folks, when they're going through it, when any human being, when they're feeling shame, guilt, anger, they're maybe having a flashback, it's hard for that person to say, oh, this is actually not me, this is the trauma, this is the expected trauma symptom. So it's very hard to differentiate yourself from these reactions. But I think it's very much doable to recognize it and actually be able to differentiate yourself, and then that itself actually helps people get better.
Interesting. So I want to expand on what you said there. So you talked a little about normal reactions. So that leads me into my next question. Are there any kind of common types of reactions that a person can have after being the victim of a crime?
Yes, I believe so. And there's a concept called acute stress or acute trauma, and then there's another concept called post-traumatic stress. and most folks who experience something that's horrific, that's catastrophic and traumatic, it is very common for them to experience these any one of these symptoms. And these reactions, I mentioned a few, but these reactions, you could kind of think of them as three categories. One category is, the brain is really trying to make sense out of what happened. And because it's trying to make sense, it keeps popping up the memory. So that's the flashback. And some people will have like flashbacks of the event. Some individuals, they may replay the event in their dreams in some form, or they may just have simply very scary dreams that wakes them up in the middle of the night. And that's, again, really the brain just trying to make sense, reprocess what's been happening. Once the brain really makes sense out of things and heals through it with kindness and compassion, really with an appropriate support, then the individuals will have less of that re-experiencing category of symptoms. And then the second reaction, which we would expect, of course, is that the person will avoid people or places, or sometimes even thinking about the event. And so, for example, if the traumatic event happened in a car, if the traumatic event happened in a room, at a park, the person will avoid that place because the body begins to rev up right when it gets near that. Kind of like what I mentioned earlier, that hypervigilance, the body becomes very hypervigilant, which is really the third category of these reactions. The body gets really ready to, in a sense, either fight or flee or freeze. And when we freeze, many things can happen. It's very common for folks to experience what's called disassociation. And disassociation looks something like, you're talking to someone, and then a memory pops up in their mind, and then you just see their eyes kind of glazing over, and they just zone out. They're, in that moment, they're no longer connected with you as a person. You could see that, and for them, it's hard for them to be really engaged in that life because their mind, in a sense, kind of pulls them back into the past. And in disassociation, which I would say it's not a common reaction, but it can happen. And I think if that does happen, it does indicate that it's worth seeking out support. But in disassociation, some individuals may even see themselves outside of their body or feel like a part of their body doesn't belong to them. And yeah, and so they're also a lot of folks, their reactions not only include these ideas of acute trauma or PTSD, but they start to cope with it by either trying to get a sense of control. So you may see a lot of obsessive behaviors, a lot of double checking, a lot of doubting themselves, a lot of rituals. Some folks may use substances to cope, and there may be even pre-existing conditions that get worse. And so, for example, if someone had a chronic pain condition, or they had cognitive issues or brain related changes, then those conditions can also worsen as well.
Hmm. What it sounds like to me is, and I'm curious your opinion, is that these flashbacks, dreams, avoiding places, the fight, flight, or freeze, it almost seems like a way that the brain is sort of protecting the person or the body from this event and the trauma. Would you say that's accurate?
Yeah. There are, there's many ideas about why these things happen, but yes, one of the ideas is that that yes, the brain is trying to protect itself. It's trying to really adapt. It's trying to function, because really the brain, you know, uh, the brain is just trying to say, okay, am I threatened right now? Okay, I if I am, then I need to either get ready to fight, freeze, or flee. But what happens, and even though there's a good intention behind these, common reactions, um, the challenge is that the brain doesn't really know that the person is no longer in the traumatic event, and that's the part where it's like, okay, the brain is trying to protect and defend, but they're in this moment, where the person is, usually experiencing, they're usually not in the situation no longer.
See. So some of the common types of reactions are, flashbacks, dreams, avoiding the event, people and places, and then, as you mentioned, the fight, flight, or freeze response. So maybe let's switch gears and talk about, crime victims reacting in a way that one would not expect. Could you touch a little bit on that? For example, such as when a domestic violence victim returns to their abuser, or when a sexual assault victim is unable to, let's say, remember the assault. Can you explain a little bit for our audience to understand maybe why that is?
Yeah, sure. Of course, there's so many factors. I kind of think of these, in terms of being specifically related to the person themselves. So as I'm mentioning, these are very broadly, defined, and it may not apply to everyone. But for example, someone who cannot remember what's been happening, to some folks, when they hear this, they think, well, how could someone not remember what the details of the event that was very traumatic? And really, there could be, of course, many reasons, but one of the ones that I find, at least in my practice, is that the person in the in that situation, when there's some sort of traumatic event happening, the brain needs to disassociate. It really needs to unplug because it's so horrific. And like you said, it's a way of protecting itself. Um, you know, so if right, and so that disassociation, in a sense, needs to happen, so the person can really get through. But also, because a lot of times trauma symptoms will interfere with cognition, like memory, attention. It's really hard for the person to really remember information and pay attention to information, until, but what we do find out is when folks get appropriate treatment, that their cognitive functioning gets better, and they actually begin to remember. You, in a sense, you kind of need to remember so that you can actually heal through that. um, so I think with appropriate treatment, that really helps. With respect to why some folks may return to the abuser, I think of these as like two major categories. There's our, individual difference factors, and then there's our society and cultural and legal factors that I think. And I think with individual factors, they're, from just my practice and working with women who have gone through these challenges.
Mm-hmm.
Um, for example, there could be children who's involved in the situation, and the person is really afraid that the abuser will hurt the children, um, or that they're going to lose their children or lose custody of their children. Um, there's also like the fear of the
Mm.
person being much more violent and doing something lethal,
Mm-hmm.
or sometimes even the person that they're afraid of their financial situation, or they may not have resources. Like, where am I going to go for safety? Like, if I leave this house right now, whose house am I going to go, and how am I going to support myself? How am I going to support my children? And this is why I think it's so important for folks to be aware of community resources, like what you
Mm-hmm.
all are doing.
Yeah.
Actually, I
Yeah.
mean,
Sure.
it really, right. I mean,
Sure.
it just really solves the issue. And then for some folks, there's religious and cultural beliefs that where something like a divorce or separation, or
Mm-hmm.
there may be there these sort of like gender roles beliefs where the person's like, I do have to stay here, I have to be loyal. But the challenge in those beliefs is that it's really um, keeping the
Mm-hmm.
person from healing and getting well. So I think those are some individual factors, and then there's of course social, more macro level factors that really plays a role. Um, for example, sometimes when folks are
Mm-hmm.
talking about this situation, and it's
Mm-hmm.
hard for folks to talk about because of that shame, but when they talk to either a supportive person or authority, then some folks may downplay it or minimize it, and that's a big problem because it takes a lot for that person to even say
Mm-hmm.
something about it. Um, and then some folks may not even understand the legal system and the procedure and the process of it. So there's this difficulty just knowing what is next from a
Mm-hmm.
legal perspective.
I see.
And right, and so these are some issues that come, and then sometimes the abuser, they often will use the family in periods where they're not abusing the person to keep the person from leaving.
What do you mean by that?
Good question. So, for example, during, if we, this is grossly oversimplified because it may not be like this for everyone, but, for example, in a
Sure.
domestic violent relationship, um, a person the abuser, um, during periods where there's no violent phases or no domestic violence, uh, and then during that time, that abuser will sometimes recruit the family to come over and pretend like things are
Mm.
fine, like the abuser never did anything, because the abuser knows that their partner likes to be with family, likes to spend time with the children. They may take the children and the family
Mm.
out on a picnic with other people involved, and that is a way of the abuser really controlling their victim, because the victim won't leave at that time because they're like, well, okay, things are I guess getting better, but no, the reality is not. And in addition to that, I mean, well, I could go on, but let me just stop there.
No, no problem. What it sounds like is that the abuser is sort of able to control the narrative and use these elements such as family relationships as a way to sort of control the situation.
Yeah, and they know, the abuser knows that it's very hard for their victim to talk about it. This is why it's important for victims to be aware that they do need to seek out a confidential and safe resource to talk about this, because there are, as you guys offering, there's major resources available.
And I know you touched on this previously in the last answer, but could you talk a little bit about how socioeconomic differences or race or culture or religion, how that impacts how a victim experiences trauma?
Yeah, sure. I mean, the from what we know from the research is that folks from low SES or low socioeconomic status, they do experience higher mental health and more challenges traumatically. And not that this is because of any specific, demographic factors, but it's, I think, because from, at least from the research, is that there isn't really those preventative and mitigating situations and factors available or resources available that really helps people to buffer against trauma. So, for a child to have a safe environment, a stable community, stable relationships, have these loving relationships and an environment that really buffers against the trauma, it can be very hard to have some of this. Of course, there are many exceptions, but these are generally some of the factors, like having like a child or a person, an adult, having uh, a loving and nurturing figure, that itself buffers against these PTSD symptoms from developing. And so when these resources are not available, for example, if education around trauma, education around mental health, resources for individuals who are victims of crime, they're not available in an environment like someone who's coming from a low SES background, that itself can really put them at risk for worsening of these symptoms.
There are buffers that can act against PTSD. Specifically, you mentioned family and perhaps close relationships and children. That's very interesting.
Yeah, these are such important, and it really teaches at least me as I'm there, kind of witnessing the stories of um, uh, folks who are going through this. Is that for me, I'm learning that people matter. People who are healed. I like the saying, "Healed people heal people," and right, it's like sort of like,
Interesting.
wow, a person who's going through trauma, if they're able to connect with a loving person that can really help them, and a kind person that can help them make sense out of what's going on, that in and of itself is healing and buffers against things, even symptoms from developing. Um, and it kind of shows us that the opposite of heal people, the opposite is, you know, hurt people hurt people.
Hmm. Interesting. Yeah, I guess I've never sort of been exposed to those concepts before. To kind of revisit it. Yeah, I've never learned that. That there can be buffers against PTSD, and that not every traumatic event will have the same impact on people. Is what it sounds like. Maybe due to these buffers.
Very true. Yeah.
Let's expand maybe on that topic of PTSD. What is the role of post traumatic stress disorder, PTSD, in a victim's recovery process?
I think PTSD plays a major role in the recovery process. We're at a point where we have, I think, amazing treatment for PTSD. We have very specialized treatment. There's actually not just one, but there's multiple. Um, and, and I think that the first step, the role of this recovery process, or the role of PTSD in this recovery process, is that the first step is what we just talked about earlier, which is, what is PTSD? What does it look like? Because the first thing folks need to do is to differentiate themselves from who they are as a person and who they are not. And usually, what they are not is those symptoms of PTSD, or the brain just trying to protect itself when we
Mm.
don't need it to.
Yeah, no, that makes a lot of sense.
So I think, because if PTSD is not recognized, then it sort of manifests in different ways. I work with folks who have very severe chronic conditions, medical conditions, and their chronic conditions get worse. Their body begins to ache.
Mm.
They begin to have headaches. They have very unusual uh, nerve-like sensations in their body that is not related to a medical condition. So yeah, so
Hmm.
PTSD can really present itself in many different ways. It could sometimes even not only manifest in physical forms, but it could also begin to affect relationships. Like if our so so to speak, if my brain meter my threat, my threat
Mm-hmm.
sensor is, is highly sensitive to threat. And I meet someone who may be another potential partner, but my prior partner was abusive. That PTSD and that threat sensor is going to go off, and it's going to affect the way I am in my relationship with this new partner.
That's all the time we have for today's episode. Please join us on our next episode for part 2 of the discussion. Thanks for listening. Now that you've heard the show, please take a moment to rate and review it. And if you have any questions about any of the information you heard today, you can reach the Victims of Crime Resource Center at 1-800-842-8467. Or you can reach us online at 1-800-VICTIMS.org or Facebook at Victims of Crime Resource Center, or Twitter at 1-800-VICTIMS. If you haven't had a chance, please take a look at some of the other episodes in our series. Thanks for listening.